This morning, we shared with you the story of Winston-Salem firefighter Tony Spagnoletti, who had a heart attack on the job, died, and was brought back to life. Tony is also an emergency medical technician, and the heart attack symptoms that he was experiencing were difficult for him to recognize, even with all of his training and experience. So joining me now to talk more about how heart attack symptoms can be really tricky to recognize are Tony Spagnoletti and Dr. Robert Applegate from Wake Forest Baptist Medical Center. Thank you both for being here this morning.
Good morning.
Thank you for having us.
Tony, I'd like to begin with you. Tell us about the symptoms that you experienced on that day.
Well, on that day, I just felt internalized chest pain. It didn't radiate like some people. It didn't go down the arm. It just was centralized, and it increased pain-wise with time.
And you and I have talked a lot during the course of doing this story, and one of the things you had mentioned to me off camera was that a few weeks prior you felt some fatigue, but it didn't really register as something that could be symptomatic of a heart attack.
Yes,
is that right?
yes. When you do something like walk up the same steps or up the same hill, like I was walking up the same hill that I walk up every, 2 times a day, walking my dogs, and I felt like I was out of shape, out of breath, and I was thinking, wow, I'm in better shape than this, and that was an indicator. Fatigue is an indicator.
Dr. Applegate, I'd like to turn to you. Could you shed some light on these symptoms that Tony mentioned, that he experienced, the fatigue a few weeks prior to, and then that internalized pain the morning of?
Sure. Most people have some kind of central chest pressure, tightness, squeezing sensation. It may radiate to the neck or to the shoulders. There may be some trouble breathing, some sweating. Those would be the classic symptoms. What we've learned, though, is a lot of people don't have classic symptoms, just like Tony, and they often wonder, was it the pizza I ate because I have indigestion? I have some pain in my back. If you're a woman, you might have different symptoms than a man.
Tell me about that, doctor. What are the differences between the men and women, the symptoms they experience?
Yeah, over the past few decades, we've learned that men and women may have completely different symptoms. Of course, women can have classic symptoms, but oftentimes it may be just pain in the arms, maybe pain in the shoulders, it may be pain in the neck. And as an individual who's never experienced a heart problem before, it can be very difficult to understand, is this a heart attack that I'm having, or is it just one of the aches and pains we all deal with?
Dr. Applegate, how crucial is time when you might be experiencing a heart attack?
Well, seconds count. Tony is, probably is one of the greatest examples of being in the right place at the right time, where people literally delivered life-saving care to him in seconds. It's not to mean that everybody should panic when they have discomfort somewhere, but I think the message we would like to get out is, if you think you're having a problem, seek medical attention.
Don't wait.
Don't wait.
All right, doctor. Wonderful advice. Dr. Robert Applegate from Wake Forest Baptist Medical Center, Tony Spagnoletti from the Winston-Salem Fire Department. Thank you both for joining us on the show this morning.
Thanks for
Thank
having
you very
me.
much.
Best of luck to you, Tony.
Thank you.